As it brings us to 8:30 and time for the High Beam Talk with the Doc this morning with Dr. Tim McKnight, being brought to you by Mako's Pharmacy at 240 East 3rd Street in downtown Yorksville. It's your local pharmacy, Mako's, a caring and knowledgeable staff focused on your health and wellness. And Dr. McKnight, hello, good morning. And
Good morning.
You didn't say any snow, did you?
I did not, no.
Okay, you're the confirmer for
I
us
would have
today.
turned around and gone home if I did. I don't like snow.
Well, I'm glad it didn't snow. That would have been a tough segment without you. As we've been talking about some different things. By the way, how's the Fit for Life class and your weight loss journey? I guess.
Yeah, it's doing good. 15 pounds for me.
Great.
So I'm still going, and but it's been satisfying. And the class is I think this is week 9, and actually this week is on flexibility. And Coach Hartzell, who was here a few weeks ago, will be presenting a lot of his information to the class tonight too. So. Yeah, we're charging right through, and I think everybody's doing well with the program.
You think flexibility is a way to perhaps keep away from sciatica as we
absolutely
transition right into that? That's our subject of the day. So what is sciatica? I mean, what is that word? That's a nerve, I guess?
It is a nerve. It's actually a collection of nerves. So at every level of your spinal column, you have nerve roots that come out at each level. I think there's a total of 31. And the last 5 or 6, as they come off of the spinal cord and out the vertebrae, they merge together in the buttocks to form this big nerve, the biggest nerve in the body, and it goes down to the leg. And so if you have an injury or pressure on any of those nerve roots coming out at any one of those levels of the vertebral column, it can cause this sciatic pain, which is it can be different for different people. It could be numbness and tingling. It can be a hot, sharp pain. Mm-hmm. It can be just a feeling of numbness or like your legs asleep. So different symptoms depending on how bad it is, but it's pretty common. And, my whole philosophy with everything is let's get to the root cause. Let's try to reverse it, try to understand what's going on and take care of it so we don't have to live with pain.
I think one of the root causes is a herniated disc, but
Absolutely.
Not everyone has that.
Absolutely. And, a lot of us have a herniated disc, but it's not enough to cause severe pain. And, often we do MRIs and we'll see a herniated disc, and the person will say, well, I'm not really having any pain. I'm not having any radicular pain, which means pain that goes from the source of the injury at the spinal cord level to the leg. They don't feel that, but it doesn't take much for that herniation to push just a little bit more against the nerve, and now you've got it.
So a herniated disc is a disc that is slipping out from in between the column?
It's a bulge, really, yeah, and it's sort of an extension of a bulge. And I think when Dr. Jakubowski was here, we talked about the disc. Think of it like a jelly-filled donut, and if you have a jelly-filled donut and you smash down on it, well, that jelly's going to go someplace, and often it will go out through the nerve where the nerve exits the spinal cord through a small opening in the bone, and it compresses on the nerve, and that causes the pain. And if we can relieve the pressure, in other words, if we can remove the tightness in the back muscles, that's kind of like if you're imagining pushing your hand on this jelly-filled donut. If you stretch those muscles, it's like releasing the pressure on the donut, and that jelly kind of sucks back in a little bit, and that may be enough to relieve the pain, but it doesn't. It's very easy for it to come back. And then sometimes that jelly-filled donut will not come back, and all the contents, all that jelly, will just spill out on the nerve root, and that has to be fixed. That's a surgical correction. But what a lot of people don't realize is that the disc itself is it looks like if you cut a tree in a cross section, if you see the rings on the tree, the disc is the same way. It just wraps around itself with all these layers of fibers. And anytime you bend and twist the wrong way, you can injure those fibers, and that can cause pain. But as you injure those fibers, then it's more likely for the jelly substance to push out and cause that impingement or that herniation.
So that would create a discomfort or a pain, and it could go anywhere from the lower back clear down your leg.
Right.
Usually one side only, though.
Well, yes, usually it affects one side, but it can affect both sides depending on where it is. It can also, if it goes straight back, it can give you a condition called spinal stenosis, where you'll see people when they walk in the store, they're leaning on the cart because if they stand straight up, their legs get tired and they give out, or their back hurts, so they lean forward. That's a classic symptom of someone with spinal stenosis. But back to sciatica, there's other issues besides just a nerve root impingement. It can be a joint dysfunction, an injury. If you injure the back, let's say, I remember once I was at the Pittsburgh airport and I saw my big suitcase coming around on this carousel, and at the last minute I grabbed this heavy suitcase. I bent and I twisted to get it, and I sort of reached over my left side and to my right side to throw it off on the floor. That was not good for my back. I felt that. That was an injury that I recovered from in a few weeks, but those repetitive types of motions can lead to permanent damage that you can't recover from. So you got to be really careful with this. And I saw somebody in the office yesterday who's a very active gentleman, but he's having back stiffness and pain, and when he stands up, especially in the morning, the back is really stiff. And his problem is that his hip flexors are really tight. So the hip flexors bring your knee up to your chest. If you sit all day, those hip flexors are going to be tight. And then when you stand, you because they're so tight, you still want to lean forward. And you can't lean forward because that looks funny. So you work really hard to extend your back straight up, and then the muscles in the back get overworked, and then they get tired and they get sore. So you have this achy back pain in the mid-back because your hip flexors are tight. And then what happens is the gluteal muscles, when you're sitting, they get weak, the buttocks muscles. So it just rotates the pelvis forward, and that puts a huge pressure on your low back. So I told him, hey, do the same thing I just did. I did this actually yesterday at the gym. I did a bunch of lunges with dumbbells and some leg presses seated where my back wasn't being involved. And my buttocks is really sore today. And it's going to be very sore for a few days, but it really does relieve pressure on the low back. And so my back pain right now is really not even there.
And I know you use a ball, but I also saw a thing on social media as an advertisement, but kind of like, it looked like a wheel, like a tire, and different radius for different levels of what it was going to do, but sciatica was one thing that maybe that could alleviate.
Right. And there's another real common condition that people get. We see this often is they'll have pain in their buttocks, their butt cheek, and it will go down their leg. Well, there's a muscle that goes from the bottom of your spinal column, your sacrum, and it attaches to the thigh bone up at the hip area. And its job is to rotate your foot externally. So if you're sitting down and you look at your feet, if you rotate your feet out, point your toes out, that muscle that allows you to do that is your piriformis muscle. If that gets really tight, and there's a number of things that can cause that muscle actually lays right over the sciatic nerve. If that muscle gets tight, it'll get thick and it'll put pressure on the sciatic nerve. Now you've got sciatic nerve pain, not from the spine so much as from this muscle. We see that all the time. Dr. Jakubowski does a great job with that particular problem by working that tightness out of the muscle and stretching it. So there's a lot of different things that can cause this, and you get to the root cause. Most people, with the right amount of activity, with stretching, with chiropractic manipulation, and with massage therapy, they can get out of this pain pretty quickly. But if you continually abuse your spine, you're liable to get in a situation where the spine just locks up and it calcifies and it doesn't want to move, and now you've got chronic pain. There's not a whole lot you can do. So the key is to keep moving, and if you sit a lot, you have to really stretch those hip flexors. That's why a lunge, when you step forward with a lunge, you're stretching those hip flexors, and then as you come up from the lunge, you're strengthening the buttocks muscle. Those are two really important muscles that have to be addressed for the back and for managing back pain. And people don't understand that. They want anti-inflammatories, or they want a shot, which at the best it might work for a couple weeks, couple months, but it's not going to fix the problem. The problem for most people is mechanical, and often, believe it or not, it's sitting. People that are driving a lot, they're liable to have back problems if they're sitting. If you're on a plane a lot, I know for me, if I fly out west, I'm on a plane all day, my back really flares up. So I have to stretch that hip flexor and strengthen the buttocks muscles.
And I would have to think with the COVID-19 and more people at home, maybe not in a less correct chair than maybe they had been in before, this could make it worse.
Absolutely, yeah. So it's the body's meant to move. It's not meant to sit. And we pay a price if we sit too much. So stretch the back. You should be able to, part of your daily routine should be to stand up and reach down and touch your toes. And if you can't get there, keep doing it until you can. And before you know it, you'll be putting a couple knuckles on the floor, or maybe even your palms. And that's just one stretch. But I really love the lunge. And I tell even elderly patients, I'll say, stand next to a counter, put your hand one of your hands on the counter so you can balance yourself, and take a step forward into a modified lunge and feel that stretch. If you're doing that, lift an arm up as you're stretching, and you'll feel that pull the hip flexor even more. A lot of people will do a lunge and they'll lean forward. Well, if you lean forward, you're not stretching the hip flexor.
Yeah.
So you got to sort of keep your torso upright as you do this. You should feel that stretch in the hip flexor area. But again, physical therapists, chiropractors, massage therapists, sports medicine trained people, all of us can help identify these issues and get you to the right place so that you can rehab this and not have to live with the pain.
And you can stop worrying about your sciatic nerve. It'll calm down.
It will calm down, yes. Just have faith, because the body can heal itself. You just got to get out of the way sometimes.
You're your own worst enemy.
That's true.
Well, Doctor, thank you so much.
You're welcome.
Dr. Tim McKnight this morning on Talk with the Doc here on the 830 High Beam. This morning's Talk with the Doc has been brought to you by Mako's Pharmacy, offering their customers and community free assistance with comparing and selecting a plan based on your specific prescription needs. Call Mako's Pharmacy. Their number is 740-922-5400.